Simulab's venipuncture pads are the industry's most realistic and affordable pads, and they are perfect for practicing ultrasound-guided needle approach and needle-to-transducer alignment. These tissue pads are ultrasound compatible and include 3 varying size vessels to simulate larger veins, which are easier to locate, and smaller veins, which can be more challenging. They also include a nerve that runs across them. The vessels are pre-filled with blue fluid so that the user can achieve a positive response when the vessel is accessed. The self-sealing tissues are durable for repeated use and will show very little residual marks under ultrasound. Exercises. The following exercises are designed to teach basic ultrasound-guided needle insertion. It has been found that practicing these exercises prior to using one of Simulab's nerve block training products will shorten the learning curve and reduce wear on the nerve block trainer. Start by orienting the probe. Next, explore the tissue, identifying the 3 vessels and the nerve. Once you have located the nerve, follow it with the probe over the length of the tissue. Next, practice orienting the probe on the nerve, both in plane and out of plane. Using the out-of-plane technique, insert the needle into each vessel. Withdraw fluid from each vessel, and remember to re-inject the fluid before removing the needle. Now, using the in-plane technique, insert the needle into each vessel. Withdraw fluid from each vessel, again re-injecting the fluid before removing the needle. Lastly, practice touching the nerve using both techniques, out of plane and in plane. Maintenance and storage. Maintenance of the tissue pads is simple and straightforward. If fluid levels become low, use the included blue fluid and the ЛУЕР-ЛОК syringe to add fluid to the vessels. Position the tissue with the thicker side facing the table so that the vessels are slightly visible. Start by adding fluid to the syringe, making sure there is no air in it. Attach the syringe to the vessel that needs fluid added. Slowly add fluid. The vessel will visibly rise. The capacity of the large vessel is 10 milliliters, the medium is 4.5 milliliters, and the small is 2.5 milliliters. When the vessel is at the desired fullness, or when it becomes slightly rounded, detach the syringe. To release any air that may be trapped in the vessel, hold the tissue upright and tap it gently. If there is still air trapped in the vessel, attach a syringe that is partially filled with fluid and pull back slightly on the plunger. Any air that is present in the vessel will rise up in the syringe and can then be replaced with fluid. Please note that due to the properties of this tissue, contact with ink or other colors will result in permanent transfer. If possible, put the pad back into its plastic bag when not in use. Also, if the tissue is stored upright, air will naturally rise and can be easily removed with a syringe. If you experience any difficulty or have any questions, please contact Simulab's customer care team for assistance.